What's up, guys? Dr. Mo here, Mohammed Ashori, MD. I'm a board certified family medicine physician. Welcome to Expat Health. So, anytime as patients, when we end up in front of a doctor, there's always that doubt, that fear. Does this person care about me? Is this person competent? Are they going to have my best interest in mind? What's their objective and how much are they going to be invested in my outcome? Probably one of the most powerful things I can do as a patient is to ask questions, is to understand where the physician comes from. So I'm going to break this up in two parts. Us as patients, our responsibility, and what a good physician should be like, and how we can kind of gauge that. So in the beginning, me as a patient, I might end up in a foreign medical system. I might end up on the phone with some random physician. And the best that I can do is gather my thoughts, be in the moment, be focused, not be walking on my phone while doing a phone consult with a physician. If I come to the visit in the doctor's office, I should have some notes that I've taken. Write your questions down. I guarantee you, once you go in front of a doctor, there's just something about it. You forget what you were going to ask. Right when you're about to finish and you're about to leave, you can always say, hey, I had a couple of things. Can I just take a look at this list and ask questions? The kind of physician who is upset by something like that is not the kind of physician you want. And we're going to touch up on that in a little bit onto the physician side of it. The patient side has to focus on telling my story as best as I can, trying to minimize the amount of medical jargon that I may have researched, because it could distract the physician. So for example, you might be thinking about a particular diagnosis, and so that physician thinks that that's all you really want to rule out, when in reality, you want to investigate what's going on. So when you come into the urgent care setting, when you go to the emergency room, when you are admitted to the hospital, the question is, who is taking care of me? So doctor, are you an internist? Are you a hospitalist? Are you a family medicine doctor? Where do you practice? What do you do? What is the reason that I'm admitted? Why can't this be, for example, done outpatient? And I'm only asking because, right? So you want to kind of be kind, you want to be gentle, because some physicians are accustomed, especially in the US, accustomed to being questioned in a more rude manner. And I don't say all patients are rude or there are rude patients. It's just that when you're a physician, you're taking care of a broad spectrum of patients, those people who get to do whatever they want and they can get away with it, and the physician has no recourse. And then there are patients who are kind of very meek, very quiet, and the physician's kind of frustrated because the physician can't get that person to really express themselves. And then you have the other group who are kind of demanding and expecting and educated, etc. So you always want to be kind, you want to be understanding. You don't know if the physician hasn't slept for 30 some hours, though we do want to get into that as well. So as a patient, I want to tell my story. I want to express what my concerns are, what I think could be going on, what I'm worried could be going on, what are some next steps that I need to take. And in between, it's nice to kind of present your story and then give the physician a bit of time to digest what you just said. That physician might say, interesting, tell me a little bit more. Or the physician might say, oh, okay, you're telling me about this hand thing and it's getting numb, and then you felt some chest pain as well. So when this pain came on, did you have the chest pain as well? Tell me a little more. These kind of open-ended questions are fabulous, a great sign that your clinician is engaged. So you should now take this time to explain it further. Well, I remember it was Friday, and if you're one of those people who's very bad with times and dates, like I am as a patient, you got to write it down. You got to look at your little cheat sheet and say, well, I remember it was Friday, and I was walking, and I felt something, and then I went home, and then I ate something, and then the pain came back. And no, it wasn't until another 2 days later where I started feeling this pain in my arm. But yeah, the chest pain is still there. It's just that it comes and goes, and it's not really predictable. But doctor, I'm really worried that it could be something heart related. Could be a heart attack. Now, keep some of those fears. Try to curb that a little bit in the beginning, because you want to be as effective as a communicator as possible. You want to be able to engage with the physician. You want to be able to tell your story. So don't worry, you'll have room at the end to bring up all your fears, all your concerns. And again, with a good physician, that's going to happen right off the bat. As a patient, you have to make demands. You have to stand your ground. You got to say what you want. You got to say what you need. Hi, doctor, I'm here because this and this has been going on, and these are the symptoms, this is what I did, this is what I tried, this is what I didn't try. The kind of patients that often physicians really click with immediately are the kind of patients who say, well, I tried this and I tried that, and my first thought was, well, what if it is a heart attack? And I called 911, or I went to the emergency room, or I took an aspirin, whatever it is that you thought you did. Or you could have said something like, I really didn't think it's a heart attack. It doesn't make sense from what I've understood. A heart attack doesn't present like that. I didn't really do anything out of the ordinary for it. I just kind of waited it out. I rested. I thought maybe it could be something muscle related. And I feel like it's still there. And at this time, I wanted to just come to an expert and see what things it could be, what I should do, what I shouldn't do. So now you presented this story. On the physician side, a good physician will be in a good mood. They're not going to be stressed. They're not going to be dismissive. Now, everybody has a personality. Even us physicians have personalities. Some of us are nerdy, and some of us are like fidgety, and some of us are super quiet, and some of us are a little bit forceful. But at the same time, we can be all of that. We can be who we are, right? But we can also be attentive. We can ask the right questions, ask very good questions, and we can get you to open up. We can make you feel comfortable. So I can gauge from you, for example, let's say I'm a male doctor. I come in, I have a female patient. She's already intimidated by me. I can say, hey, I know this is a bit awkward and uncomfortable because you're telling me a very personal story. Don't worry, I have female nurses here. They can come in with us if we need a physical exam. I can also get you a different physician if you prefer a female physician, right? These are the kind of things you expect from a physician. We've done this. We've seen thousands of patients. We should know when a patient is afraid, when a patient is hiding something from us, when a patient isn't telling us the whole story, or when the patient tells us a little bit, hey doc, yesterday I had some chest pain, so I don't know, I'm here. And then you're like, well, tell me a little bit more. Well, I don't know, you're the doctor, you tell me what's going on. And that happens. You'd be shocked how many times I've walked into an urgent care emergency room, patient straight up, like, yeah, I'm having chest pain, I don't know what's going on. And if I ask a question, they're like, I don't know, you're the doctor, you tell me. And that's a fear thing, right? The patient is afraid, and the patient's kind of regressing a little bit to certain behaviors. So I can say, okay, let me tell you what are some good ways for us to move forward. What I think we should do, let me get some really good information about exactly how things happened and when they happened, because that story can tell me a lot about how certain conditions present. For example, a heart attack is going to be very different from a muscle spasm. So if I get that story from you, I can better assess what tests we can do moving forward. But I totally understand if you can't tell me that story, or if you're afraid, don't worry, we'll take it one step at a time. That will usually put the patient at ease. And then I can ask better questions. Okay, take me back to Monday. What happened Monday? What did you first feel? Now all of a sudden the patient's going to open up. Now another patient comes and says, well, I don't know, like the pain is really bad, and you told me that the EKG showed that it's a heart thing. What do I do now? What are you guys going to do? The physician, a good physician, right, is going to say, listen, I've seen many patients like this. I'm an experienced family medicine doctor who also works in the emergency room. I see patients here in the ER. I assure you that I have a lot of good experience with this. I also have a cardiologist on call whom I can call, and I always run these cases by them. Now I can tell you that when I call this cardiologist, they're probably going to say that we should take you to the cath lab to do a procedure where we put something into your artery to maybe open it up, or at least take a look. So I want to kind of talk through this with you, so I can gauge and see what it is that you really want to do. What are you afraid of? What are you worried about? The procedure might be something like this. Now we have some other alternatives that we can discuss, but let me just kind of break this down for you slowly. So you tell me how you feel right now, and then we can progress one step at a time. So the patient is now probably going to be like, okay, this doctor's open to having a discussion, is going to explain everything to me. Let me get some of my big fears out. And so now you as the patient feel like, oh my God, I can really tell this guy everything, and sometimes you got to tell something really awkward. Maybe a rape happened. Maybe you have a personal sexual preference and you did something that you normally feel is looked down upon. And this physician, are they open to it? Are they receptive, right? So that's what you do as a patient to gauge it. And if that person is not the right person, we'll get into that in a different topic, but I'm going to talk about how to have the uncomfortable conversation with your doctor, especially in the emergency room setting, but even in the outpatient, in the specialty setting, where you need to ask for a second opinion and say, I really feel like I'm having a hard time describing everything, communicating things with you. I don't know, maybe it could be me, but I feel like maybe you're a bit like in a hurry, you're rushed, and you're not really listening to me. I don't know, like I feel like this is not going to go well. Sometimes, and I've had this happen to me, the patient tells me something like that. I'm like, wait, I'm sorry, hold on. Okay, let's start over again. I had no idea that's how you feel. So tell me how exactly this happened. Let's go one step at a time. And listen, worst case scenario, I have another doctor here working in the ER with me. I can have you talk to them instead. Again, I think it's better to leave that part for a different video where we can kind of dive into that. But when you can feel that the physician is going to listen to you and is attentive, you can move forward, you can have the discussion. And now that you broke the history down for the physician, now that the physician asked some really good questions, the next step is talking about what can I do for this myself? What are the alternatives to everything you're recommending? What are the bad outcomes? What is your experience with this? I know you're telling me you have to take me to surgery for an appendectomy. How many of these have you done? How comfortable are you with this? And again, you've already built that relationship. So it's going to be much more likely that it's going to go well. So I hope this is helpful. A kind of a good way to gauge what a physician is like and their competence and how much they care about you, and feeling comfortable and confident going forward and just really pushing back a little bit to make sure that that physician is going to care about you.